Finding Nemo is about Marlin the clownfish who had lost his wife and only have one son left, that is Nemo. But one day, Nemo was captured and brought to a fish tank. While Nemo met some new friend and tried to escape there, Marlin tried to set an adventure to find Nemo. In the end, they united. Nemo had grown more, and Marlin learned to be less overprotective. The character that we're going to diagnose on is Gurgle, one of Nevo's friend that he made in the fish tank, and we're going to diagnose him on OCD or obsessive compulsive disorder. Obsessive and compulsive disorder is characterized by two factors by the DSM-5 is obsessive and compulsive. The obsession is the inflated dysfunctional belief that they have that make them have anxiety or distress. And compulsion is the repetitive action that they have to do to release that distress. Obsession, when they all are time consuming. Starting with Gurgle obsession. Gurgle obsession is he have a dysfunctional belief in German contamination being more dangerous than it is. First evidence is when he first met Nemo. He found that Nemo was contaminated because he's from the ocean. So he immediately screamed and pushed Nemo aside. It's make Nemo very uncomfortable. And the second evidence is that when he saw a human spitting water from their mouth, he remarked that humans are disgusting having water contaminated with water in their mouth. Third evidence is that when everyone is carrying out the plan to make the tank dirty so they can escape, gurgles cannot do anything else but go around screaming and distressing about this situation. And we know a factor of OCD that's mentioned in the DSM-5 is that the patient have to attempt to ignore or suppress the obsession, which we know Gurgle is doing here because he agreed to carry out the plan and he's trying to suppress it so that they could carry out the plan to escape. For Gurgle compulsive action, although we can only present on one character, but I have to introduce you with this character named Jack, and he's one of the Nino friend that he made in the fish tank, and he's a cleaner shrimp. Google compulsive action is not showing because he already have Jack, a cleaning shrimp, an expert on cleaning. If Gurgle needs to clean, he's called for Jack. Like when he first met Nemo, he called for Jack over to clean Nemo rather than cleaning it himself. And another outsource that he have is the water filter. When we could see that when the water filter is broken, Gurgle is in distress because there's no cleaning. So Gurgle compulsive action does not came from himself, but while watching Jack and water filter, we could see that he depend on them for his compulsive action. A symptom that is not shown in Gurgle that mentioned in the DSM-5 is that is it time consuming or not. We cannot observe the hours that he spent every day on his obsession, but we know that of the many scenes we see him in, he is struggle with his obsession. Another tool that I use to diagnose him is the Year-Brown Obsessive Compulsive Scale, which is a gold standard in accessing OCD symptoms. We will input his behavior into this scale, and will give us it's correlate to a number, and when we add all these numbers up, we will see how severe he is, and he is scoring 22 out of 40, which correlate to moderate OCD. And just to be minded, I did not input the question that include his hour in because we don't have information about his hour, but it's already 22. With his hour, one might speculate that he would go to severe OCD zone. Culture is very important to diagnose Gurgle. One is because he is a fish and is really different than human. And second, fish in a fish tank and fish in the ocean have a very different view on contaminated, with fish living in a fish tank being more clean. The fish tank clean culture have a big effect on Gurgle OCD. We could see the effect on OCD by culture in Egypt, where 90% of the population getting affected by the culture to get OCD, or in China, 67% of the population have OCD. If Google were to have a therapy in his movie, it will be depends on the fish that he have therapy with. If the fish is inside the fish tank with him, his OCD will be diagnosed less severe. If the fish is outside the fish tank and in the ocean, it would be more severe because he need to live with contaminate to survive. Some of the stigma on OCD is that it is a personality trait, is being tidy or clean, it is very unusual, it is people that are crazy, or is caused by bad parenting. Let's go to the treatment for Google. I choose ERP treatment, exposure and response prevention. ERP is deliver 1 hour session 2 times a week. First, I will talk to Gargo to find out why, how, and how long he have OCD every day. Next, I will tell him about his nature of his OCD, so he's willing to take treatment. Third, I will develop a hierarchy of fear, so his least fear at the bottom and the most fear at the top. For exposure exercise, I will expose him to the fear in the hierarchy that we already made in a safe environment. A little by little, move up the hierarchy. In the meanwhile, I will instruct him to resist the temptation for his compulsive behavior, and also I will reinforce him with encouragement so he will do better. The reason I choose ERP because it is the most effective, better than RIS, SMT, or SRI alone. The only more effective method is ERP plus SRI, but because SRI is not as a drug not tested on fish, and for cost reason, ERP is the most logical. In general, the movie is quite accurate in showing OCD. We could see the obsession and the compulsive action and the distress, although I would like to see more of the compulsive action if there's no jack and water filter. But the movie is still based on the stigma of OCD that's being tidy or clean.